Hello.
Hello.
So I've been told that you central guys among us are joining the class. This is what I've been told. You are joining the class without paying anything. Not yet. Are you there?
Hello, sir.
Your own people are telling me this. You should be careful. Be careful. I want to have a clear mind when I'm doing anything. Some of the people, central guys, are telling me this, and these are the things that has been you are doing over there, central. Want shortcuts. Always trying to be fast. See, what did I get to last time? Hurry up, hurry up. It's left to something small, then call it a day.
The last time we were on the characteristic of the semi and the end semi.
Am I not through with that?
Yes, please, you are done with that. We ended with the characteristic of the end semi.
Any question about that? Matthias. Matthias.
Hello, sir.
There's one Isaac. Can you take Isaac off from there? Hmm?
Yes, please.
Going through, I want to see the names for a purpose. I don't want Isaac, then you leave it like that. I told you that. There's also Mommy. Who is Mommy? Who is Isaac?
Sir, please, I'm here. I'm trying to change my name, but I'm not able to.
So please change it, Mommy. Who is Isaac? Who is Isaac? Isaac, Matthias.
Hello, sir.
Take Isaac from.
Yes, please. I've not been made yet, so I'm not able to.
Who is the host? Who is the host?
Please, a minute. Hello, Dr. Tucker.
Matthias.
Hello, sir.
Matthias. Uh-huh. Who is the host?
Please have been made a
Hmm?
please have been made a host now.
Okay. Any question about what you learn about acute coronary syndrome? Hello.
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 Any question about what we did?
No, please.
Okay, so tell me the characteristics of STEMI. What are some of the characteristics of STEMI?
There's ST elevation.
There's ST elevation.
There is persistent occlusion.
So there's persistent occlusion. Which again?
There will be elevated troponins.
So troponins. Troponins. So what again? What again?
There's myocardial infarction.
It's an infection. So tell me the difference between STEMI and unstable angina.
You tell me there's ST elevation. In unstable angina, there's no ST elevation.
That's one.
You tell me there's troponins. unstable angina, there's no troponins.
So unstable angina, no troponins, no ST elevation. But for STEMI, there's troponins, elevation of troponins. So management, we have learned how to manage the stable angina. So let me ask you a quick question. What will be, I get worried. The way people are behaving. When I'm teaching you, I'm not happy. What is going on? So at times I get for this year batch, I am not so happy I'm teaching you guys. For this year batch. So the help that I'm supposed to give you is necessary. How do you manage it? Let me ask a quick question. A quick question for variant angina, which medication will be the best to manage variant angina? Variant angina. Which medication? We talked about beta blocker. We said that beta blocker should not be used. And so if beta blocker shouldn't be used, which medication?
So we can use the non-hydrochloridium like verapamil and
So we can use. So can you use ifedipine? Can we use amlodipine? Can
No,
you
please.
use? Why?
Because they have almost negligible effect on the heart.
So what is the difference between ifedipine and amlodipine in terms of the heart?
Nifedipine has about 1% effect on the heart, whilst amlodipine has no effect at all.
So I'm giving you assignments. I want you to go into details. Huh? Not for now, but I'm giving you assignment. Giving you assignment. Kingsley, I will ask you on Friday. Huh?
Yes, doctor.
So we have these calcium channel blockers, and they block channels. And we have different types of channels. Look for different types of channels. And find out those channels where they are, if they are in the heart. And find out, link those channels with amlodipine. If you are doing your masters, I could have been pushing you along that line. But I will take what you said for now. But I want you to do that and link such that in future, when you stand in your web, you can do more explanation to that. So look for the channels, different types of calcium channel. To link the channels to amlodipine, effect of amlodipine. Okay. So we can use verapamil, we can use DTiazine. Why, Kingsley, why are you considering this medication for that? Why are you considering this medication for that?
I wasn't the one who said it.
No, I'm asking, why are we considering these non-hydropyridines? Why? Why are we doing that? So can't you tell me, why are we considering non-hydropyridines for variant angina? Kingsley, can you help me?
Doc, I want to.
A few people are talking on this platform. Few. Few people are talking.
Doc,
I'm listening now. Why do you consider? Who is Mimi Mensa? I haven't heard Mimi Mensa. Who is Mimi Mensa? Who is Mercy? But the Ochre. Who is Ochre? Who is Mimi Mensa? No response. But the name is here. But the Ochre Mercy. Sandra. Kingsley, go on.
so I was thinking because they will slow the contractility in the heart.
Why are we listening? The way you answer questions, why are we considering invariant angina? Samuel Donko. So are all these people on the platform? Are all these people? Good.
Wanted to try.
Matthias,
Okay, I want to try.
try.
Hello, sir.
Matthias, I'm mentioning names, but nobody's responding. It's very few people. Who is Kevin Nkrumah? Kevin Nkrumah. Popo, let's go.
Yes, sir. Okay. In the beginning, when you started, you said you made mention that in the variant angina, there's some form of spasm, and contractions. That's good. That occurs.
Okay, at work. Kingsley says something. Kingsley says something. Kingsley says something, and he said, I wasn't happy about certain. He mentioned something. I wasn't happy. Be specific and tell me. It's straightforward. Be specific and tell me.
And say, please, because they are used because the non-dihydropyridines, they mostly act like they are 99%. Their 99% activity is on the.
Don't go there. Don't go there. It's a straightforward thing. Why do we consider? Don't go back and be saying for this is 99%. No. It's no. Why is it that we use this drug in variant angina? Can't you be specific and straightforward?
It causes vasodilation of the coronary vessels.
So straightforward. Kingsley was saying the heart. Coco, you didn't mention any. Adam is saying this. So the spasms that we are talking about, the coronary spasm. So straightforward. You go to that, it's a coronary spasm causing variant angina. And for spasms to occur, you need the influx of calcium. That is a contraction. You need influx of calcium. And when you block the calcium, the influx recedes, the contraction recedes, the spasms. So we are using that on coronary vessels, not the heart. Kingsley, are you there? You said, you use the heart instead of using the coronary vessels, because what is happening at the coronary vessels, the spasm. So you are talking about it slows down no, it's not the heart, it's the vessels, coronary vessels. How do you manage this? How do you manage? Let me start with STEMI. How do you manage STEMI? How do you manage STEMI? What will come into your mind? Is it it's
Please, say what will come into my mind. I'll be thinking of how to open the blocked vessel.
good. So what would you do to do that? To open up?
So they'll put a stent, they'll open it.
So go on. I'm happy about that. But normally, these things are not the work of pharmacists.
Yes, sir.
But I'm happy about the research. So go on.
So, except from where I did my hospital attachment, that was what I saw them do.
So tell me more. I want to know more about it.
Yeah.
Mhm. I'm
So
happy.
after they are able to open the occluded vessel, they'll put a stent there to keep it open. Then they put the person on I think antiplatelets.
Is it antiplatelets?
Yeah. So I know they used to give them some medication.
Hey, pharmacist.
Dog, they use fibrinolytics.
They
Yeah.
give fibrinolytics.
Munja Masa, I'm talking to Benedicta. Hey, the way she was talking, I see it's from Sefi Forest. Pharmacist. What the doctors are doing, you recall. The stent, you recall. But you are not telling they give some medication. Your area. So seeing this, you'll be happy to find out which medication they were given and why they are giving this medication. You are telling me this pharmacist. I said I was happy the way you started and yet, Vendicta, they will put stents. Stents, you are okay. That is not the work of us. That's for the doctors. Our work, the medication, Benedicta, tell me some of the medication that they were giving. Don't tell me they gave some medication. We are not serious at all. Serious. When you get to the hospital, we are not serious. And because of that, we are not respected. The doctors don't, because it's like we are accountants, pharmacy accountants. When prescription comes, we just pick it paracetamol 2-3 times by 7, then they calculate 42. We were giving some medication. As pharmacists, you should be interested in those medications. And you should be interested. Why are you giving this? You ask, why are you giving this? Why are you giving this? That's a serious student. Don't come and say, oh, they gave medication and you are laughing. A doctor would prove that the doctors even know our area more than us. The doctors, I'm telling you. That's why it's difficult for us to get to the word. Why? Because they know our area. So when you are not with them, they don't care. They don't see any. You saw them giving this. I was happy. Started with, but why is it that the medication? I say you are giving some medication. Gloria, tell me, which medication? Which medication will come into your mind? Gloria, you were talking.
Fibrinolytics.
Jemima is saying what? Fibrinolytics.
Fibrinolytics.
So why that?
Hello, dog.
Mm-hmm.
Please, you called my name.
Okay. You said they gave fibrinolytics or what? Jemima said it to you.
Yes.
Yes, please.
Because, dog, they give the fibrinolytics because the veins are rich in fibrin. So the fibrinolytics will work best.
Fibrinolytics will work best. So which type were they giving? And why were they giving fibrinolytics?
Please, they gave to dissolve.
Jemima, where are you? Where are you?
Please, I'm in the house.
Noise behind.
Sorry about that.
So why are they giving it? Why are they giving fibrinolytics?
Please, they gave to dissolve the clot.
So they gave it to dissolve the clot.
Yes,
So
please.
That is what they told you. To dissolve the clots. So listen, patient will come with this STEMI. And the first thing that should come into your mind is to make the line patent. That is the first thing. The patient with STEMI will also be experiencing chest pain. How do you manage the pain? How do you manage the chest pain?
Okay, use GTA.
You can use what?
GTA.
You can use what? GT and sublingual GT.
Yes,
So
please.
if you use the sublingual GT and the patient is not getting relief, what will you do for the patient? Oh,
Can be used.
what? If we use sublingual, so patients, telling patient to be coming with pain. So you need to think about the pain. And you need to make the line patent. So for the pain, you said that we should give what? Sublingual GT. You give sublingual GT, so the patient is experiencing, and what will you do for the patient?
Can do morphine.
You give what?
Morphine. Yeah.
Good. You give morphine. So what is the benefit of giving the morphine?
It is an anxiolytic, and then it has vasodilatory effects too.
Good. Good. So normally when they are giving morphine, they will not be giving morphine alone. In these instances, they will not give morphine alone. So tell me, if you are giving morphine, which drug will you add it to it? Which drug? I'm giving morphine to a patient. Which drug?
Metoclopramide.
So normally they add metoclopramide. Why is it so?
To combat the emetic effect of the morphine.
So morphine can cause vomiting. So we do that. And please, it's important. The first thing is important to work on the pain. It's important to work on the pain. Who can tell me, just want to know clinically, who can tell me why, apart from the suffering that the patient is getting, the pain that is getting, what can the pain also do to harm the patient? So it's important to reduce the pain quickly. Going to reduce the pain. What will be the effect of the pain? Who can tell me the effect? So we are giving morphine to reduce the pain. If I don't reduce the pain, patient will be in that pain, which is one. Again, if a patient is in pain, what effect will the patient get?
But they will increase the BP. It can increase the BP.
Can increase the BP. Good. So tell me how can cause elevation of BP. Tell me why it can increase the BP. Who can do that? You are right. You are right. So tell me, you should be able to explain this to me.
Doc, can we say the pain will trigger the sympathetic nervous system?
Yeah, I'm asking you a question. You're also asking me a question.
Okay, so Doc, the pain will trigger the sympathetic which may lead to the increase in BP.
So if it triggers the sympathetic arm, how will it lead to increase in BP? I just want us to get it, understand the pathway. All that you are saying, you are right. You are right. If the sympathetic arm is activated because the pain is putting stress on the patient, and therefore, because the patient is having that stress, sympathetic activity will be activated. And if it's activated, what next? What will happen such that there will be elevation?
No, please, it will cause vasoconstriction.
It will cause good. It will cause vasoconstriction. So the sympathetic activation will cause vasoconstriction, and that will increase the workload of the heart by increasing the BP. So that is that. So please, it's better to reduce the pain because the pain would activate the sympathetic activity. And this will cause vasoconstriction to increase the BP. So is it clear, class? Is it clear to everybody?
Yes, please.
Yes, dog.
So the pain should be relieved by either using sublingual GTM or morphine. Good. So the next thing is, how do you make the line patent? There's persistent occlusion. If I say patent, what does it mean? If I say patent, what does it mean? If I say patent, what does it mean? Oh, if I use the word patent, what does it mean?
Dog, to open up.
What is to open up? Patent means what?
Means usually when we say the airway is patent, we mean to say the airway is open and then there's no obstruction. It's unobstructed.
So there will be a free flow of what? Blood. So patent, we want to make the line patent such that there will be a free flow of blood to the myocardium. So that is the next thing that you have to think about. So the next thing is to make the line patent. How do you make the line patent? Then you give a drug. It should be done by a specialist. You give a drug. That drug is called thrombolytics or fibrinolytics. And somebody was saying that fibrinolytics will dissolve. There's a difference between dissolving and breaking. To break down, it causes lysis. Thrombolytics, it will cause lysis of Nice, are you getting me? It will cause lysis of the thrombus or the plaque. Lysis, break down the plaque. This is what we do. And for these thrombolytics or fibrinolytics, we have two types. So for management of STEMI, it's different from managing stable angina, different from managing STEMI. The difference is the first part that we are talking about. These first parts that we are talking about is the first part that we are talking about is this. This is the first part that we are talking about. That we'll be using this drug to cause lysis to the thrombus or the plaque. That is the first. When we are done, then we'll be going back to our aspirins and statins and those medications that we use for stable. So the difference is the first part, using those. There's other stents, that is what the doctors, that at times they can cushion balloon, blow the balloon, and the balloon will dilate. This is not our work. That's why I don't want to talk about it. To talk about our area. So we have two types of fibrinolytics or thrombolytics. So one is fibrin specific, and the other one is non-fibrin specific. So fibrin specifics are ones that would go straight to where the plaque or the thrombus is and go and cause lysis. And non-fibrin specifics are these non-fibrin specifics. They act like a blind person. Anything that resembles plaque in the system, it will cause lysis to it. So we have fibrin specific and non-fibrin specific. Fibrin specifics are very, very expensive. Very expensive. Fibrin specific, very expensive. And they will go